All right. Hello, everyone. Thank you so much for joining us, and a big, big congratulations for those of you that got your results today. I mean, we had planned this orientation a long time ago, but luckily it was coincided on the same day, which is amazing. And I'm sure many of you have questions about how should you be preparing for part two exam. Um, so we have got sessions back to back. So I will be walking you through the steps how to prepare. So just bear with me. And we're gonna get started. All right. So just a moment. So just give me few minutes and then we're gonna start. I'm just waiting for a couple of people to join in. Every time we have a session, there are people that struggle with signing. And then let's start the part two exam prep. And if you have any questions, you're welcome to pop it in the chat here for us. And we can have a discussion about it. So I'm just going to be starting shortly. So now we had a very, very good result. So I'll talk about our success stories for part two. I mean, this year, just from the very beginning, um, you know, I think it's been an amazing year, and not only for the candidates, they put their heart and soul, they work really hard, and I guess the efforts goes both ways. So, all right, let me see if that's working, and I'm sharing my screen. So the session today is that we guide you on making the right choices because this is something that we see every year. Every year, the results come out. And then, of course, you guys are quite excited to sit for this exam. Let me share my screen. And then here we are. Yep, so we're ready to start. All right, so let's get on with it. So as we talk about part two exam, so we had very, very good results. So just from January to March, we had about 51 people so far, and you can see our page as well. We've listed down the names as well. So about 51 people have passed just in 3 months. Now, this is the kind of results we used to see like in 6 months. But we're talking about first quarter of year. So now there could be a couple of reasons as to why the results are starting to be so amazing. Of course, there is a great need of dentists in Australia. But at the same time, of course, it's the way we deliver these courses. So it's no longer about memorizing stuff. So just going back to Warriors, this is a question that oftentimes people ask us, why did you name it Warriors, ADC Warriors? Why can't you just go with some decent dental names? And I guess it goes back to our philosophy, like each and every one of us are also fighting a battle. It's not an easy exam. It's going to take a toll on your mental health. It's going to take a toll on your finances. It's going to take a toll on your relationship. So, but again, this is how we thrive. This is so they say that you have to rise from your ashes. Your great growth comes from there. So that's who we are. So now, I've been teaching since 2018, so it's been a very, very long time since I've been teaching. So I guess from day one that people know me more for OSCEs, I guess, because I started from there. From day one, 2018 July, when they introduced OSCEs, I started from there. So from the very, very beginning. And of course, with the passage of time, I realized that how people were failing in different aspects of exams. So we opened a small setup with 6 dental chairs. Then it wasn't enough. And then we decided, okay, time to expand. And now we've got a really big setup. As you can see, this is where we have got the same simulation chairs as the exam. Now, what makes us stand apart and what do we do differently? I guess it goes back to the vision. Um, so it doesn't matter from where you take your coaching, because all the academies are amazing. Each one have got their own teaching style. Each one will have their own methodology. But for us, it's different because when I started teaching from communication skills, I noticed that people were failing skilled. So we got into skilled. Then I noticed people were failing technical. So we got into technical. So we kind of grew with what the demand. Then I realized, okay, their concepts are not great. That could be the reason why they're failing a lot. So we decided to get into part one so that we can get those concepts right in part one. And then after that, we started recently that a lot of people, they never got a chance to sit for exam at all. Or many of them, they cleared their exam. Even we went to the ADX recently. We met many of our candidates that cleared their exam many, many years ago and are still practicing. So we're just going one step at a time. Then we realized that, okay, well, actually, visa is another issue where people are not getting visas. They have booked their exam, they want to come here, they don't have visas, or they want to give the exam, they fail, they don't have finances to pay for it. Okay, then we said, okay, can we find some companies that we can collaborate with? So it's just over a period of time without realizing. So we're not just an academy anymore. So we are now more like a platform. So now we are working even beyond ADC. We've got our own 700 alumni network and we're expanding. So it's not just about training you guys for ADC exam. We're also creating these job pathways. We're connecting you with the employers. So there's a lot of things that I need to share that we've been doing. So our current partners that we are working with, of course, people know us with the Bano Healthcare Groups. We launched our very popular Navigate Your Future, where we have Stream 1 and Stream 2. But other than that, we're also now partnering with many different recruitment agencies. We're also working with many private dental practices. And I guess what we're starting to build is that even beyond ADC, when you pass your exam, which we notice many candidates have cleared, but they're working for these companies or practices for 5 years, 6 years. And I asked them, many of them, I said, so do you have your own practice? Are you planning? They say, oh, well, I'm thinking, yes, I want to, but it's very difficult. So what we started doing now is we're advocating for you guys, so we're creating this amazing platform for you. So once you pass your exam, hopefully, so with these companies, we're talking on your behalf that yes, everybody's giving percentage, but if you stick around with a company or private practice, can they offer you any equity? So we're working now to build a dentist equity. So this is how you can see we are invested into this entire process. It is not just a training academy. We will grow with you. We will be walking with you every step of the way. And that's what you will see in our teaching methodology as well. So, and that was the major reason why we invested heavily into our system, into our setup. So hopefully we are expanding to Sydney in coming months. You never know, and then hopefully other cities. But for now, we are based in Brisbane, and we're also bringing an online version of technicals as well. But the whole idea was to create a space, not only that we train you guys for part two, but also we use the same space for CPD courses. And our CPD courses are also about to start with Dr. Peter. I think we had Dr. Peter. I think I was going to put his photo. So he's an amazing clinician with over 40 years of experience. And then we have his first webinar. Then we have got quite a few webinars coming up. So we will invite our part one and part two candidates as well to attend. You can get your points. So that's where we're bridging it. So not only we are providing coaching for part one, part two, but we're helping now with visas. We're helping with sponsorships. With our academic alliance programs, as we are currently operating in Pakistan. Soon we're going to India, Brazil, Egypt. We're also helping medical doctors with recruitment because many of the dentists, they came back, they said, oh, my husband is a medical doctor and I'm happy to come, but my husband, he needs to look for a job. We said, okay, let's find your husband a job as well. So if you can see that we just kind of grew based on the problems. So you never know how the next few years would go as well. So let's go back to part two. What is part two, and how is it going to be different to part one exam? Now, in part one exam, of course, it was more about computer based. You could actually just study at your own pace. You didn't have to interact much. You could watch the recorded lessons, and that was about it. But unfortunately, part two is different. You really are forced to interact. As much as part one was about looking at your knowledge IQ, part two is about emotional intelligence. So it is about the guidelines that you've read. It is now, can you apply those guidelines in a clinical situation? And oftentimes it's the plan B and C that works. There's a lot of adjustment that is required. So, for example, that guideline only tells you how to treat that infection. But if it's the same patient in a rural or the regional area, then you have to kind of work around those guidelines. So this is the exam venue. Now, part two exam, it happens throughout the year. And as you can see, it's more expensive. And the pass rate is a little bit lower than part one exam. I think I had this. So I've got a couple of handbooks. I'm sure you guys can check it all on the ADC website. And where is it? Okay, I've got too many things open. So part one, if you can see, I mean, last year was the only times that part one we saw such a big dip in the passing grade, which went down to 12. Normally part one is fairly good. But part two is always very low. It's never been great. If you look at it on an average, the number of people applying for the exam has increased over a period of time, and this is 2025. And if you look at the number of people that are passing this exam, overall, it's always 266, 257. I mean, this is the max we ever got to, but I think this year is different. This year is getting better. So if you think about it, even last year, the results that we deliver. So normally we deliver about 50% of the overall result in general. But I think this year we're a little bit more ambitious. We're now aiming for 70% to 80% overall. We like to challenge. So our biggest competitor is ourselves. We like to challenge ourselves. So, and I think the way the first quarter has gone, we've already hit 51 people have passed the exam. So I think we're on track with that. So it's been great. And you can see that the areas which I will talk about, the areas where people are failing the most and the areas that we need to work out. So in terms of finances, you can see it costs you around just the exam fees, about 4 grand, 4,775. Now, if you are not in Melbourne and you're traveling within Australia, then, when you go to the exam, you have to think about your flights, right? If you have to think about your accommodation when you go. And this is just about the exam. You also have to think about your home setup. You also have to think about the courses that you're going to be taking. Now, that is the most important decisions that you have to make. Again, all the academies are beautiful. Everybody has got their own strength. Everybody has got um, their own success story, and you really have to see what resonates with you. So I'm just gonna ask, kind of give you some of the things that we do. I'm gonna give you some questions that might help you ask, including us and all academies. Those questions are important. They will help you with making that informed decision. That's what we teach in OSCEs as well. Now, the way it works, so you just got your results. So there's 3 application period when you have to apply for part 2. So the first one, of course, the exams have been booked already. So it was open between 11 to 22 of Feb. Now the next application period they're going to open is between 17 to 23rd or 26th of June. Now, this is where the problem comes. Now, most of you, if you're giving this exam for the very first time, I wouldn't suggest you going for this application period. The problem with that is I have seen it year by year. Same thing. I thought I'm gonna get a December. I thought I'm gonna get a later day, but I got the first batch. The dates went out very quickly. We hear it every single time. So now you have to sit and calculate. So now you need about, let's say you've cleared your exam. By the time you get around, you decide on which courses you're going to take. By the time you do your home setup, I think you're officially going to start practicing is in probably mid-May onwards or June. And they will open the application here. Now, once you make a payment for the exam, which is this amount that you're going to be paying, then they will confirm and then they would say, okay, 1st July to 3rd July, we're going to open the portal and then you have to choose a date. Now, the way you're going to choose the date, you will go onto your portal and there's going to be a list of dates available. And it will be from December to August. And everybody gets excited. Now, what happened is different people have different strategies. Let's say you decide, okay, I want to go on for example, 3rd of December. By the time you click, by the time the page refresh, what if there was somebody else already clicked on that date and it's gone? And your page reload, they say the date is unavailable. So one of the guys, he gave a very good tip. He was like, I knew people would go for those later dates. So I chose a very safe one. I chose like somewhere, like I think it was between May to August. So he said, I knew. So I kind of chose July from the beginning because I knew everybody would go after August. So, but he learned his lesson the first time. So first time he had to refund the money because he got a very early date. Second time he was like, I knew how to do it. But same thing I'm going to tell you as well. So there's not much of a difference between December and January. So what will happen is that the next application period they're going to open is from Jan to May. So if you're really giving this exam, if you've never tried it before, don't apply in this period. Don't do it. I want you to prepare. I want you to think about it. Even let's say now that ADC has increased the validity, you've got 5 years to appear for the exam. What's the rush? Take your time. If you take 1 year, the chances are you can pass this exam. And that's what we've done. Most of these people the 51 people that have cleared with us this year, there was a lot of them that were first timers. They only did it once. And we made this plan for them. And we said, you've got to stick to this plan. There is no shortcut. Because remember, we are preparing you guys not just to pass this exam. We are preparing you for these companies. We're preparing you for these agencies. And we're constantly talking to them about what sort of dentist they're looking for. So this is why it's important that you're not rushing through it. All right. But again, if I would encourage that if you have any specific questions regarding your circumstances, you can always email my team. Whether you take our courses or don't, that doesn't matter, but we're always open to have a conversation with you And then we will give you advice based on your circumstances, whether you're working, whether you're not working, whether you have kids. There's no one size fit all. All right. So, but those of you that have done this exam many times, you've gone back to part one and now you're back to part two. Yeah, this is a very good application period for you. You've done it, you know it. So I think that would be a good time. So part two exam, like part one is a 2-day exam. You've got a technical day exam, which is a 6-hour exam. In fact, I've started teaching technicals as well. I find it quite interesting. I was teaching until 5 p.m. today. I got off my OSCE class and I jumped into the technical. And this is basically the exam center, and this is our place, as you can see. I mean, more or less very similar. And I guess these are the same cavouchers as you would find in the exam. This is the same cavouchers you will find it in the university. And for me, the main thing was CPD. We wanted to get into CPD programs, and these chairs are very powerful. It can handle those high-end rotary handpieces. So that was the main idea of putting heavy investments. You might find other academies, of course, they have this amazing setup as well, but nobody has got this setup at all. And the good thing about these chairs is that you will learn how to operate these chairs. You will learn we will teach you how it all functions, because these are the same setup, as you can see. Now, on the technical day, so this is just our simulation lab. So we've got about 16 chairs. So we've kept the distance as well. All right. So this is basically our simulation lab. As you can see, this is the inside. This is all our mannequins. So as part of our different programs, we do provide you guys the same mannequins. We do provide the handpieces. So that's going to be a separate discussion on Wednesday. So tomorrow we're going to discuss communication, and on Wednesday we're going to talk in detail about the technicals and why we're different. Okay. So this is our boardroom. This is where we do the crash courses. This is where we are going to be running our CPD courses. This is where we do our infection control classes. We've got a very nice view from here. Now technical exam. So amalgam is now out, which is good. So we take it out. Now we have 6 tasks. So you get 6 hours. Now previously there used to be 12 candidates. They added 1 more chair. So now we have Monday, Tuesday, group 1, 1 batch, and then Wednesday, Thursday is another batch. So once you pick the date, closer to exam, ADC will send you your schedule, and it will let you know if you're having OSCE on day 1 or day 2. Is it in the morning or is it in the afternoon? So that is, again, ADC will let you know. But let's say you have technical on day 1. So there will be 14 candidates. Of course, there are 14 chairs. And it's going to be a 6-hour exam where you will have those scenarios on the screen with x-rays. And you will be asked to perform 6 tasks. So we have crown prep. Oh, believe me, I was doing crown prep assessments today, and it's very interesting how everybody's doing that. I mean, look, don't memorize these rubrics. This is not something that I struggle with, or with endo. The concepts are not good. So we're going to talk in detail on Wednesday why people are failing technicals, theories. Then we have restoration task, composite. So amalgam has been removed. Thank God. Look, amalgam, it was a disaster. I mean, I failed my exam because of amalgam. And it would just set so quickly. And good thing is that it's out. So now we have an anterior composite, and we're going to have a posterior composite. And then you also have a temporary crown prep, basically a provy you're going to be making for your crown. So 6 tasks. Now, in order for you to pass your technical exam, you need to pass your cluster like you did in your part 1. So it doesn't matter. I've seen people failing 2 tasks, but overall it's a pass. And I've seen people failing one, which I did in my exam, amalgam, overall a fail, even despite that everything is passed. But what matters is cluster. That's what we want to pass. It's a point system, okay? And if a cluster is down, that means we've made some brutal mistake. But what ADC has been kind enough now, they're actually giving feedback. I had a chance to look at some of the feedbacks that some candidates got. It's amazing. So I took it from ADC website, and they said now they will give you feedback like this. And one of the girls, I was looking at her I think feedback form. So she failed crown prep, she failed composite, and it was clearly marked like this, why she failed. And the area was highlighted like this. So it's good to see now which areas, because before that it was just pass or a fail. Now you actually get to see the areas, and you also get to see here. Why? What was the issue? Do you see? Metal ceramic crown prep. The margin form was not good, the path of insertion or the occlusal reduction allowing full occlusal ceramic coverage. So that's really, really good. If it's a pass, great. If it's a fail, you get a feedback. So that's a very good move by the ADC. And it was very interesting as well today as I was doing the assessment. I asked one of the girls, I was like, well, can you assess it for me? She's like, oh, there's so many criteria for crown prep. I can't even remember. I said, the reason why, because we're memorizing it. So how the examiners would assess and how should you prepare? So these rubrics mean something inside the patient's mouth. It's not just the criteria. Now, what we do differently, of course, everybody has got their own teaching methodology. I like to always explain, if you did a certain thing, how is that going to impact the patient? So for example, I mean, you've got so many criterias that we're talking about. If it's, for example, composite. Yes, the first thing I say, can you please assess it for me? Everybody goes after the cusp position, the cusp height, the marginal ridge, but they don't see these high spots that they've left. They don't say anything about the contour where the food will get wedged here. They don't talk about the roughness or the gaps because composite is very prone to secondary decay. They don't talk about if you keep this area narrow, it will break. So those are the things that I say, okay, if this criteria, if you've done this, how is that going to look inside the patient's mouth? And with that kind of, I think, teaching, I think that's been a big reason why we've started to deliver that phenomenal results, because that's how the examiners will assess. It's not about making it look beautiful. It's about making it function. The only thing that you want to make it beautiful is a class 4 composite. But if it's posterior composite, we're doing crown preps, we have to look at the functionality of it. And that's what the assessments would look like. But I'll go in detail on Wednesday about the technicals and how we teach, and also about our online technical that is going to come out soon. It's going to be amazing, the online technical program that we're designing. Now, the clinical day, which is going to be, again, depends a day 1 or a day 2. So this is the second day of the exam. Now you have got 10 stations. So this is ADC corridor. And this is where you have these small consult rooms. Each room will have a number on it. This is the door that you enter, and these are all the rooms. And these are the bigger rooms. Now, the bigger rooms will have skill loss keys. We have 4 skill loss keys. I think they have shared. I was looking at, you will see that they have shared a lot of photos this time in their handbook, in the videos. And I was just looking, there was one of the handbooks. Let me see where I saved it. There was one of the handbooks where they shared all the photos about the x-rays. And let me see. Yeah, this is the exam center. Look at this. This is the technical day. These are all the 14 chairs that you will see. And there was a photo. I don't know. There was somewhere here. But there was a photo about the exam center, the X-ray unit. I can't find it. So we have the same X-ray machine as the exam flamenco. So you have this X-ray. Now, it's also very, very important that when you're practicing, a lot of people they go down in X-ray in LA in a few of the tasks because now X-ray is not just about pretending, right? Now, when you go for practice at many different places, the problem is that many academies are not investing into, I mean, they have amazing facility, but not many because there's a lot of regulation for X-rays. The room should be completely insulated where you're installing that's again going to be added cost. And on top of that, of course, you have to have a radiation officer. So there's a lot of rules and regulation to it. So we've gone above and beyond. We got the same X-ray machine. We have a purpose-built X-ray room where we take the X-rays, and the whole idea is that you get to see what you're exposing. Is it a cone cut? Have you exposed it enough? If you don't, we redo it again because in the exam they're going to expose it. That's the whole assessment area. And there are other tasks as well. So you have rubber dam, fissure sealant, X-ray extraction, LA scaling, CPR, syncope, and matrix map. So for skill loss keys, you will need to take demos. Our skill assessments are very popular. So what we also do, which we found it beneficial, that people take our skill loss key courses, and then we have skill assessments, which means that we assess them based on these, just this. I mean, we have clinical marks separate, but we have skill assessments. So where there's going to be one mentor, and the candidates they go from one room to another with strict infection control protocol. We check them. We make sure that they are ticking all the boxes. And then you have your communication. So this is, well, like I said, people know me for communication skills. This is how ADC Warrior started. This is my passion. This is what I love, communication. And what we introduced is what I learned from UK. You'll find, yeah, and it's very interesting. So when in 2018, when ADC introduced the OSCEs, like I said, this was only a handful of academies back then. And even with those academies that we had, majority of them, look, it's nice to see if we say that you should go to an ADC pass out dentist. But the question here is who trained that ADC pass out? Now, if somebody is a registered dentist, it's good for them. But did they get that training from a university? Did they go through a proper training program? No, right? So most of them have been trained by me. And the problem with that is now my notes are everywhere. So that's why we've chucked it away. So we're no longer using those notes. So last week I was doing a mock with one of the girls, and she's not enrolled in my program. She was beautiful. She has a beautiful way of explanation. And I did ask, I said, why did you come so late to me? I wish I had more time to work on your areas because her communication was brilliant, but her knowledge was not good. And I knew what she's going to say before she started because, like I said, my notes are with all academies. My notes are with everyone, even with ADC examiners. They have those notes. So that's why we dumped it. We're no longer using that script. We no longer stick to that script. Now we focus on the main idea. What is the main idea? Just giving you an example. I asked her, I said, okay, we've got this case, fluorosis, and I want you to see, if that's what is being delivered. So I created these notes a long time ago. And this is how my flowchart. So I'm changing it all the way now. We're moving away from these flowcharts. I'm redesigning as per new TG now. So we've changed our curriculum completely. But you know what, people, what they do is, it's one of our communication OSCEs. And in the exam, even the examiners know that the candidates will talk about do nothing. Then they're going to talk about microabrasion. And soon after this, they're going to talk about resin infiltration and then veneer. And then they're going to say micro and resin are best. You say this, you're gone. This is 100% my notes, 100% the examiners know you're going to say it. So, and same thing, we have a few other cases. For example, we have this case about a minor ulcer. A patient has a squamous cell carcinoma on the lower jaw. In my notes that I wrote a long time ago, I mentioned about that first we're going to ask about the denture, then we're going to take an ulcer history. But we tried and it didn't work. It didn't work anymore. The examiners, of course, ulcer is something that I saw. A patient is not concerned. Patient just wants a denture. So we chucked it away. Yeah, my notes were still there, but we said don't use it. So we changed our format. But it's very interesting. Whenever I'm doing this role play, especially for those that are not enrolled in my course, this is something I check. Within 2 minutes, are they going to talk about the ulcer? And if they do, number one, I know they're using my old notes. And two, they're going to get in trouble with that. So this has been the reason why a lot of people are failing now, because examiners know you're using a script. With your starting line, thank you, Mr. Singh, for, can I make you upright? No, those are not working anymore. So please make sure that the person that you are going to take classes or the ones that you enrolling, you need to ask who was their mentor, because a lot of stuff they're using would be mine. So, but it's up to you. But just saying that, or you just prepare on your own. ChatGPT is great. Or we are coming with a very incredible AI e-learning platform as well soon. So communication, basically, you've got two cluster one, you've got two cluster two, and you've got two cluster three stations. So in cluster ones, they're testing, do you know how to ask questions? In cluster two, it's more about management. So one of the guys I was speaking to the other day, he has been failing repetitively cluster two. There's another girl, she's repetitively failing cluster one. So for those of you that have chronic, if you're repetitively failing a certain cluster, I would suggest book a role play with me. I can tell you exactly where you're going wrong. It's not about knowledge, it's about a lack of skill. Because the examiners, they're assessing you all in one go. So let me show you how does it look like. So these are the sets that are coming in exam. So you might notice, you're like, what's yellow? What's quake? So it's just a quick way of color coding. Like, in the clinics, you do like batch labeling, that, okay, this batch, that batch, so this is similar to that. So if somebody says, oh, I got gold set, we automatically know what are those OSCEs in that gold set. If they say, I got gold and green, then people ask, which combination did you get? So it's kind of, it works like that. So there's about 52 communication OSCE cases. Believe me, you cannot memorize these. You cannot memorize. And the way that I love to teach is I will introduce you to this patient. And tomorrow we do have a communication role play. I would invite you, I would love you to attend tomorrow to see how a communication should be done. In the exam, what is their expectation? So one examiner is analyzing your knowledge-based rubric, of course. We can't just have casual conversation. You need to know the objective. Like one of the cases I was teaching today was periodontal abscess. So this case is about a patient comes to you with immense amount of pain, and patient has got this gum boil on the tooth. So where is the gum boil? All right. And patient has this pain, and sometimes tooth is extended. Now, yes, it is about periodontal abscess. I will explain to the patient what it is, why it happened, how we're going to manage. But the question here is, why did this patient end up with this periodontal abscess? Now, the main reason for that was this patient was a smoker. Now, health promotion is very important, just like in your part one, in part two as well. Health promotion is huge. All these OSCEs are built on health promotion. So what we do then, I was mentioning to them, I said, look, as Rumi says, the cure of the pain is in the pain, right? So pain is a very good teacher, right? Anything that causes pain, we always remember that lesson. So this patient has come to us with pain. And I'm sure this patient doesn't want to have similar infection or a similar situation again in the future. So basically, we're using this as a starting point to see if this patient would consider quitting smoking. So we talk a lot about motivational interview. So remember, part two is not about passing exam. This is basically the preparation, right? So remember, before the rain comes, there's a lot of preparation happens. First the wind comes, then the cloud forms, then the rain comes, and then the seed grows. So same thing here. So we're preparing you for beyond ADC. If you're looking for shortcut, you're going to struggle beyond ADC. So whether you do it once, you do it right, and you understand. If you know how to do the motivational interview, if you know how to ask questions, if you work on your emotional intelligence, again, it's nobody's born with it. Something we develop. If you focus on your critical thinking and you understand the why behind it, you're going to go a long way. And that's what we're working. We're working beyond ADC to build your equity. We are negotiating on your behalf with these companies to co-found a practice with you, to give you an opportunity to buy a franchise. But they all are saying we want somebody that has great communication skills. And that takes me to this annual report. If you see, majority of the people, they go down either in effective communication or infection control. These are the two major domains where people are going down. So it's not about showing off the examiner how good we are in terms of our knowledge. It is about when I walk into the room, do I taking that opportunity? Like, for example, if a patient says, I want to make a complaint against the dentist, the question is not, okay, well, let me guide you through the process. No, I always teach them, I say, ask the patient, well, look, yeah, for sure. If you want to make a complaint, I can certainly help you. But if I may ask, why do you want to do that? Now, that why is going to get you to the heart of the case. Does this patient want a refund? Does this patient wants to teach this dentist a lesson? Was this patient upset because of the poor communication? What exactly does this patient want? And I can then tailor my response based on that, which is what we're going to do in the clinic as well. So that's what communication is. So we do have online, our premium is very popular. We have basic and premium plan. I was going to show you our website. So hopefully once our technical is up and running, online technical, then we'll show you that as well. But let me show you our portal. Our portal is temporary where we are working. Oh my goodness. So that portal that we're working on, once that finalizes, is going to be so unique. One of the most powerful AI e-learning platforms that we're creating. So this is what our communication portal is looking like at the moment, temporarily for the next couple of months until we redesign it. Where you will find our ADC therapeutic guideline discussion classes are all there. You'll find our support classes. This is what everybody loves. So if you are part of our comprehensive or you're part of our communication, you'll have 1 year subscription. Now, as part of a subscription, regardless of when you want to take the live classes or not, or when your technicals are, you are welcome. We will add you in our support groups. And this is where we have support classes. Tuesdays are always done by me, unless I'm sick, unless I'm in the hospital. Usually, even from the hospitals, I would work, believe me, unless I'm dead or dying, I would not skip a day. And Friday, I have my other mentor. So it's 8 p.m. And you can see these are all our role plays. So we are uploading. This is like 1 hour discussions so people, they say, oh, look, I am struggling with this case. Like last week, I was discussing this asthmatic patient with cellulitis according to the new therapeutic guideline. It changes. This is Dr. Zanara. So you'll see all of that. And that's going to be our support throughout the year. This is basically our orientation and study plan. So you will go here. You'll find important topic list. You'll find communication videos. So we do have orientation here, communication orientation. So these are our rubric discussions. And what we did differently was this modules. So modules, this is something we're now updating according to the new TG. Even the old cases have changed the way we're doing. We are approaching it very, very differently. You'll see one of the role plays tomorrow that we're going to do, how different it is to what you knew previously. And with each module, if you go, you'll find the videos, you'll find the notes underneath it. And what we did differently was that people were struggling. We had all the guidelines and books, and a lot of people, they came back, they said, but there's so much. I don't know what to study. So we're like, okay, let's make it simple. So let's say on the website, I have yellow set. Then you go into the reference section and you click here, and it will take you to our Dropbox. You come here. So I'm going to open yellow. Now here in the yellow set, I can watch the video. I can see the notes underneath it. And when you come here in the Dropbox, for every, so this, let's say this is 8-year-old boy. Here is risk assessment. So you'll see that this is the video, there's the notes. Now, we also encourage you to read. So what we're trying to do is add articles that we think is relevant to this case. We are adding it here for you guys to read because we understand, because they do cross question. And when we do the live classes, in the live classes, then we basically, my job is to guide you. So these OSCEs are all led by me. I teach OSCEs. We do one-on-one role plays as well. Now those are done with me and with my other mentors as well. Technicals as well. Technicals as well. I'm really enjoying it. It's not too bad. My mentors are giving demos, but I'm teaching the candidates how to self-assess, basically. Or I'm known for hacks. I'm gonna teach some really good shortcuts. I love shortcuts, simple techniques. Now, the way you will pass or fail, this is your how am I scored for each station. If you were to pass this exam, you have to pass cluster 1, cluster 2, cluster 3. You have to pass communication. Cluster on its own, you have to pass infection control. And also in your technical, you have to pass your prep, base, and restoration. So 1, 2, 3, 4, 5, 6, 7. 7 clusters. In order to pass this exam, you have to clear all of these 7 clusters, which is very tricky because sometimes people, they've done really amazing, but they went down in infection control, or they went down in one case in clinical information and the entire exam is down. We've seen that. And yet you see there are people that have got 1 pass, 1 fail, 1 pass, 1 fail, but overall it's a pass because the mistake was not brutal, it was not critical. So that's what it is. So what matters is we want an overall pass. So this I can explain more in detail later. So that's how the marking system works. And then there's another thing called global marking. So global marking means, let's say you've got in your exam yellow set. Your exam was on Monday, Tuesday. Then we had another batch, they might have got pink set. The exam was Wednesday, Thursday. And then we had another batch the following week, Monday, Tuesday. They got orange set. Now, you 3 will be assessed together. And I used to always think, but I said, that's not fair. Well, orange is more difficult. Yellow is easy. Why are they being assessed together in the same thing? So at the end of the day, it doesn't matter which OSCE it is. What matters is your skill set. Now, whether it's a palatal swelling or it's orthodontic, what we're checking is, do you know how to ask questions? Do you know how to collect data? How to talk to the patient about the investigations to do? What is that process that you do to come to the provisional diagnosis? So do you see whether it's Carey's risk assessment, whether it's missing lateral, whether it's palatal swelling, what we're looking is your skill set, basically. So that I think has cleared a lot of things, and that's what the global marking is. So even if you've missed quite a few things, these days we're emphasizing again, it's not about talking too much, it's talking less, but doing it well. All right. So that's what basically this exam is all about. And like I said, this is how the examiner wants the OSCE. This is how we present. We go into every detail and we want to talk about everything and anything. No, that's not needed. And also, it's important that the patient is involved in the conversation. There is not something, I think, and I've spoken to many of the employers, companies, um, some other people that have been involved in the process, and I said, what is the major challenge that you see here in Australia when these overseas dentists they come? And most of them they said that even though they're amazing with their hand skills, the problem is that, for example, if I'm feeling cold, I'm going to assume that the other person is also cold, projecting my opinion on the patient because I think this option is good, so the patient should go with this option. So we have difficulty with informed consent, number one. And this is what we call it also paternalistic approach. Please don't become the patient's dad. This is from a book. This is Prophet book. It says that long ago, doctors used to think they are their patient's dad or a parent. Do this. This is my way or highway. But it doesn't work. It's patient's body. If a patient doesn't want to do a treatment, you can give your preferred option, you cannot force it. If a patient doesn't want to go to the hospital, it's okay. You just have to give all options. Yes, I will recommend hospital, but I'm not going to force it. Because if the moment you're going to force it, that's when we're going to fail an exam. So that's the area that would require. So I do find fresh graduates a lot better in terms of passing this exam because fresh graduates are like blank canvas. I can paint anything on it. And I do find teaching the fresh grads way more easier compared to people that have been practicing for years overseas because even though your clinical skills are great, on a patient is great, but when it comes to exam, we're talking about very specific skill set. It's a standardized exam. That's where we kind of go back and forth. Um, I'm going to talk about home setup on Wednesday, more in detail. And also, we've got some amazing packages. Now we are working with a few companies, and we are coming with this amazing warrior packs for you guys. And we will guide you on the pricing. Of course, it's got nothing to do with us. We're just basically creating that student portal for you guys and a few companies, and we can guide you from where you can buy what materials you need. Of course, ADC has provided us a list, but yeah, these are the list. And these are the lists that we shared with our partners. Look at this. Oh, this is where I was like, I did see an X-ray. We've got the same X-ray. This is the Planmanka Pro X-ray. This is the bucket. So these are the burrs that will be given in the exam. So where to buy those burrs? If you look at these numbers, it's very confusing. But what we've done is with the companies, we've worked around and each one is coming with these amazing discounts, packages for you guys. So yeah, we'll provide you more detail on Wednesday. All right, I think I've spoken for way too much. Any questions for me up till here? If you have any questions, you're always welcome to pop it in the chat. Can I explain the cluster slide? Okay. We're doing communication tomorrow, but I'm happy to explain it as well. Tomorrow is our communication role play. So we have, where is my PowerPoint? Sorry, I've got too many PowerPoints. So at the end of the day, what the examiners are assessing a few things. Now, in the middle is your cluster, person-centered care. So when we talk about cluster 1, 2, 3, this is basically right in the middle. Um, but the problem is that you guys are not failing because of these, the one in the middle, the requirement. Each cluster has requirement. This is all given in ADC handbook, and this is what we keep practicing during the role play. Before the role play, I always say that, all right, what rubrics, which cluster it is, what rubrics are we looking at? The main reason we're failing is because of number one, professionalism. Now, when we talk about professionalism, and there's a couple of things that are interesting. Number one, it talks about holistic. Holistic means mind, body. So if a patient is smirking, you can't just say, well, you shouldn't be smirking. Going back to that case of minor ulcer that I was talking about, that case of squamous cell carcinoma that we have. Why people are failing is because we're dealing with squamous cell carcinoma. All right. This is a cluster one. Now, from the data gathering, I will ask questions, of course. But the main idea is, why did this patient end up with cancer? Cancer just doesn't appear out of nowhere. Look, I'm a cancer survivor, and I know how life can be. Of course, for me, I've finished my treatment, so I'm doing amazing. And I think it was important for me to experience. God has put me through all these amazing experiences so that I can come out and I'll tell you guys how it was. But I was lucky enough to have that support. But these patients, some of them, they don't. And especially in this case, like one of the versions we have is that his partner passed away. Now, imagine if this patient does find out that he has a cancer. He's already struggling emotionally. And that's the reason why he's smoking so much and is drinking so much. And he hasn't been eating well, which eating food, stress is what keeps the immunity. So because of his partner passing away, his diet was affected, his sleep was affected, his mental stability was not the same. So immunity went down. And in order for him to cope with his mental health, he smoked and he drank. So what happened? Unhealthy habits went, and that's why patient ended up. So it's easy for me to say, oh, I'm going to refer you to a specialist. Let's do a biopsy. Let's find out what that is. Yeah, patient will go. Okay, what next? We know that people, even with lung cancer, they continue to smoke. This patient will not give up until you find out why are they smoking? Why are they drinking alcohol? So is there a way they could manage that stress or depression differently, right? So it really depends on what we're dealing with. For example, we have cases where patient says, I've got upcoming exam, I'm stressed a lot. We say, don't get stressed. Life is good. Like, right? And the other person's looking at your face like, come on, you have no idea. So connecting with the patient, well, look, I know you have an exam, and I'm sure there's a lot that you need to cover, but it's also important that, we are giving our body a little bit of time. It's like your mobile phone. If you keep running it out, it will heat up. So, do you get any breaks? What do you do? So, if patient says, no, I'm not taking any break, that's a good starting point. We say, well, let's start from there. I know you have to study. I'm not saying that you shouldn't, but planning it, taking some breaks can be a good starting point. So, just simple advices is what they're looking for. So that's what we're talking about, holistic approach. So when they're coming to you with a problem inside the mouth, that has a lot to do with what's been going on in their life. You fix that, this will go away. And also what I find is that the environmental impact, every prescription you're writing, every radiation exposure, it has an impact. So x-rays, referrals, antibiotics, you got to be very careful with these ones. You need to know how to work within your abilities. Your ability is not defined by you, it is defined by the guidelines. So that's something we focus a lot on. Ethical is very, very important. And then, of course, comes your leadership skills. Oh, believe me, they give you scenarios about dispute. Your colleague did a bad job, and patient is shouting on the top of the lung about your colleague, and like, oh my goodness, I didn't even do that. There is a scenario we have where a patient has a denture that kept breaking, and your colleague gave this denture, a metal denture, 6 months ago. Patient paid a little bit more, but this patient comes today and is so upset because his tooth got fractured. And one of the girls, this was her first attempt. She's like, it was my first attempt. I walked into the exam. And look, the exam is very, I'm telling you, the examiners are beautiful. You're gonna absolutely love it. I love being there. If you know, they are very helpful as well. But they're, it's like acting. They have been told to play that role. And even before the role play, they're gonna smile at you, they're gonna interact. During the role play, even though if they're upset, after the role play, they're gonna smile back, they're gonna give you a thumbs up. So nothing personal, it's all just a role play. So she said, I walked into the room, first role play ever, and it was my first station. Usually that's the one that people mess it up. And I sat down, she saw that kid, she was like, best of luck, angry patient. And she said, within a minute, and I said to the patient, well, tell me more about what happened. The examiner said, you are fraud, your colleague is a fraud. And, I came and I had this denture, and now my denture is broken. So I'm very, very upset. And this girl was like, nobody ever told me a fraud in my real life, let alone somebody saying that to me in the exam. She said, I lost it. I just didn't know what to do. I didn't know what to say, right? So that's where it comes. That's why these role plays are so, so important. If you cannot do part two without practicing, you have to do role play. And that's why we call it. So in my premium classes, we encourage everybody to role play. I call it more like a public speaking session. I would never, I mean, of course, I do the assessments, but I will not publicly say to the person, oh, you've done a bad job, even though no matter how bad it is, it's just encouraging you to talk, 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 get over that fear. But one on one, yes, I'm going to give you very feedback. And even when we do role playing in the classes, I always say that book a time with me. I'll give you very specific feedback on what you can do and where you can improve. But that's where I'm saying that they want to see how you're going to manage an angry patient, how you're going to go ethically if incident happened, help promotion, critical thinking. So these are all very, very important. So for on-site, yes, there is a guy, he was from Pakistan. He cleared his part one and he never got a chance to sit for part two exam. He applied three times and he got rejected. And of course, many of your colleagues will say the amount of people that got their visas rejected for practical exam is staggering. I guess with the way the world is going, and it's not just limited to one country. We saw so many from Nepal, from India, from Pakistan, even from Middle East. They have been rejected visas. Because when you come for ADC exam, it's a 2-day exam. And that's what people, they come on a visitor visa. Many of them got rejected, unfortunately. So that's what we're trying to help the candidates. Now, we are, of course, going to be working towards accreditation ourselves, but so far, even if many candidates, they've taken our technical coaching. So we give them, if let's say somebody takes our 2 weeks and 3 weeks on site technical, we do issue them a letter saying that they're coming here for a training program. And I think 99% of them got visas. We never had any problem apart from one person that got rejected. And but yeah, that's been fairly good with us. So but hopefully, we're working to resolve. We've got our own immigration agents now. We have got these companies that I'm working with. So hopefully, in about 2 months, we're gonna come up with even more support, programs for you guys. No, no. Look again. If you would need a home setup, if you have a good dental practice, if they would allow you to work there, fine, go for it. You need a mannequin for sure. If they would allow you to stay after hours, go for it. Um, but if not, then you will need it at home. Look, many people they have this arrangement with the clinic and they practice there, they don't bring that noise home. But I'll talk more detail in about what are the things you would need if you were thinking about practicing at home. All right. Any other question for me? No questions? All right. Well, sounds good. I guess it's been almost an hour. So tomorrow night we're doing a role play. I will be asking one of my mentor to do a role play with me. So you can see how hard she's going to be.